Nemo, when you see yourself on screen, you can start.
Hello, thank you all for coming this evening. My name is Nemo Hussein and I will be the chair for this meeting. We have a packed meeting and some excellent speakers. When we first called this meeting, the government had pre-announced one of the worst decisions of the whole pandemic, and there are many to choose from. It is incredible, but true, that people who are self-isolating are no longer legally obliged to do so. Our speakers will discuss many of the widespread implications of this policy. But since calling the meeting, the situation has gone from bad to worse. We will now not have most testing. Tracing has gone almost completely. The government will not be publishing data on the key indicators for cases and deaths, and free tests will no longer be available from the 1st of April. This is clearly a measure that will hit the low paid and the poor the hardest. This is a policy which adds up to pretending the virus has gone away, that leaves us defenseless in the face of continued spread and new variants, and which will deepen the inequality that has been a hallmark of the response to the pandemic. So our speakers have a lot to discuss in light of this, and will want to make many other points. But before we begin, I want to draw your attention to two things. The first is that we have a petition aimed at the government to stop the ending of self-isolation. We will put that in the chat, and please do share widely with friends, family, co-workers, etc., workmates rather. The second is the next issue of our newsletter, Arguments for Activists, will be out early next week. Make sure you register for a copy. Thank you very much. And our first speaker this evening is Diane Abbott, co-convener of the Zero COVID campaign. Diane will provide some political context to the current government policies.
Thank you all for coming this evening. We have some great speakers this evening, so I'm not going to speak for very long. Boris Johnson was triumphant this week, announcing the end of COVID restrictions, and in particular, he announced the end of self-isolation. And the right-wing newspapers were ecstatic. They called it Freedom Day. But it is not freedom for ordinary people, it is freedom for COVID to let rip. Out in the real world, the pandemic is very far from over. People continue to get ill and people continue to die. We should be clear that the so-called restrictions are really safeguards, and removing safeguards is removing restrictions on the virus. So this policy is not victory over the virus, as some of the backbenchers and some parts of the press say. It's a victory for the virus and a defeat for the population whose government has abandoned them. We hear a lot of noise about we're not a country that restricts individual freedoms. This is the rallying cry of the anti-vaxxers, the anti-maskers and the far right. But it's just not true. This country has long been, as all responsible governments are, a country which does limit personal freedom. That's why seatbelts are compulsory. That's why smoking is not allowed in public places. That's why you can be fined for dumping rubbish in the street. We do not have a free-fall on the roads. We have the highway code, traffic lights and imprisonment for those who endanger life. The restriction of individual rights for the public good, and particularly for public health, has been the test of society from time immemorial. That's why we have any laws at all. I draw two conclusions from Boris' announcement this week. The first is sadly many more people become victims of the virus that could have been avoided. We know that those people are low paid, disabled people, Black and Asian people. They are all disproportionately victims of the pandemic, and government policies such as cutting sick pay and ending free testing will just deepen inequality. Secondly, and more hopefully, this cannot last. No society can run like this. Something will have to give. We have to face up to the fact that this is going to be a long time before we win. There will be no quick reversal, as the Tories see sense. But there will be reversal. Think of the struggles against war, against racism, for the vote, against slavery or the death penalty. They were all prolonged fights, and some of them aren't even over yet. But we can win this fight, and we have to. Thank you.
Thank you to Diane for sending us that video. I'm delighted to welcome back our next speaker to this meeting, Professor Robert West, Professor of Health Psychology at UCL in London. Professor West is a member of both SAGE and Independent SAGE, and is a returning speaker. It's such a great pleasure to have him back with us. He'll be able to inform us about the medical and behavioural consequences of the government's decision to allow complete freedom for the virus. Professor West.
Thank you very much. I'm just going to share my screen so that you can see a few slides that I've put together. And I hope, Nima, you're nodding that you can see it. Correct. Good. Yeah, so I've just really put together a few slides to put some facts and figures on the situation. That sort of sets the scene for the policy decisions that are being made. Right, well, let's have a look at where we are. First of all, cases. Let's have a look at cases. Now, these data, some of you, I'm sure, are aficionados of the ONS infection survey, and if you are, this should look familiar to you. If you're not an aficionado of the ONS infection survey, this should be your go-to source, particularly now, or at least until it's cancelled, for the incidence, the daily rates, because as people, well, it's always been the case that the official figures on the COVID dashboard haven't actually given you the numbers of cases per day, because of course it depends on how many people come forward for testing. But the ONS survey is an absolute goldmine of information. It is the go-to place for so much of this data. Anyway, so the ONS infection survey is a very large representative sample of the population, tells us that as of the last count, which is, it's always about a week out of date, around 2 million people in, and I'm just going to give you the data for England so that it's all on the same page, as it were. 2 million people in England have COVID, which is literally 1 in 25 of all people in this country, actually barring the very lowest age range, but all the people you're likely to bump into on the street. That is still massive. And if you look at this graph here, you'll see that it's way, way above what it was going back through the periods that we saw previously when we had waves, okay? So this last wave in terms of infections has been astronomic. Now, we'll come on to the consequences of that in a minute. But another way to look at this, and it's hard to find on the infection survey, but ONS very kindly send me the data, is you can calculate the incidence. That's the daily rate at which people are getting infected. So the one on the left is the number of people who are infected, 125 of the population. This is how many people get infected every single day. At its peak, it was getting on for 300, actually slightly more than 300,000 per day. It's still, you can see it's sort of a bit all over the place because things are sort of changing quickly, but it's still in the region of around 200,000 cases, new cases per day. Okay, that's an awful lot, obviously, and it's an order of magnitude greater than it was in these previous peaks that we saw. Okay, So we're getting a lot of infection. The deaths for England, I've pulled out the deaths for England rather than the UK, so you can see it as comparable. There are currently, well, I say currently, the data are always, you have to take a 7-day average. So again, the data are always about a week out of date. There are currently about 150 deaths per day with COVID on the death certificate. So don't let anyone tell you that these, that the figures, like the Telegraph said, I think today, in fact, I think it might have been, I may be wrong, but anyway, certain newspapers have been saying, oh, it's not really a problem because these are people who died with COVID, not from COVID. These are people who died from COVID, and it's about 150 a day at the moment, which if you multiply that up, you can see that that is a pretty large number per year. Now, the good news in terms of largely because, not because necessarily Omicron is milder in and of itself, but largely because of high coverage on vaccinations, is the good news is that the case fatality ratio is approximately 1 in 2,000 now. What that means is 1 in 2,000 people who are infected will die as a result of getting COVID at the moment. Now you think, well, 1 in 2,000, that doesn't sound too bad. But when you multiply that up, obviously, by the number of infections that you get, and we bear in mind the fact that reinfections are common, that you're looking at a sustained death rate that I will give you the figures for in a minute. What about hospital admissions? We're currently looking at around 1,000 in England alone, 1,000 hospital admissions per day. And again, this chart shows you the sort of how this is tracked. And you can see that even with the with vaccination, this is all with vaccinations, high rates of vaccinations. These are all people, where we've got, something like 70-odd% of the population or 80% of the population vaccinated. And people who have previously had COVID. To give you an idea, the proportion of the population that has antibodies for COVID, either because they've been infected in the past or because they've been vaccinated, is more than 98%. Practically the whole population has immunity from COVID, and yet this is what we're seeing. And that's a really important message, because it tells you what the future is going to be like if we don't actively try and control infection rates through other means. And in fact, this is a very interesting part of the graph here. When we had Delta, this was going up and down a bit, but it basically wasn't changing. If we were going to be developing herd immunity, that figure, that graph would have been gradually declining, in fact, quite steeply declining. It wasn't. And the reason is herd immunity is not a thing. It's not a thing with COVID, partly because of new variants, but partly because of reinfections with old variants. So that needs to be put out the window. And then, of course, we have long COVID. According to the ONS, again, about 1.3 million people are living with symptoms persisting for more than 4 weeks. Now, you might think, well, okay, 4 weeks could be worse. Well, hang on a minute. 71% of those, almost 1 million people, have had it for more than 12 weeks. And about 42%, 500,000, have had COVID at least a year ago. So we are talking about potentially very long-lasting chronic disease, which will impact on people's ability to work. It'll impact on the economy. And there's a serious risk going forward that it will shorten people's lives. And so this figure here represents about 1 in 50 of the whole population. And this is after just, a couple of years of COVID. So, which is now, as we know, endemic, which only means that it's not going away anytime soon. It doesn't mean it's mild, just means it's not going it's going away. Okay, so what does that mean going forward? Well, of course, the great unknown, except that it is kind of known, is what's going to happen in terms of new variants. Now, NervTag, which is a subgroup of SAGE, has said it confidently expects there to be a new variant coming sometime down the track in the next few months or so. And contrary to what you will hear from people who are suffering from what you might call hopium disorder, hopium addiction, there is absolutely no reason to believe that it will be milder. It could be more severe, it could be milder, it could be the same. There is nothing in the evolution of viruses like this which makes it trend towards more mild disease. So anyway, so we're going to have a new variant coming down the track, probably, almost certainly, soon at some point. But let's suppose we don't. Let's suppose that we're dealing with Omicron for the foreseeable future and its various permutations. These are my figures. This is what I estimate based on what we've seen up to date, that it's going to be killing somewhere between 10,000 and 80,000 people a year. Now, that's a very wide range, and but it critically depends on what we do. It's more likely to be 80,000 if the government's current policies are allowed to stand. It could be as little as 10,000 or possibly even fewer if we're able to do something about it. The average loss of life, it doesn't just kill old people who are going to die next year anyway, which would be bad enough, but the average loss of life is around 10 years. Now, these figures, 80,000 and 10 years, are very familiar to me as someone working in public health. And I don't know if you can think of something else that kills about 80,000 people a year and gives a loss of life expectancy of around 10 years. Of course, it's smoking. So when we think that surely to goodness, a government cannot be allowed to get away with killing or allowing to die 80,000 of its population, losing an average of 10 years of life expectancy each year, well, I'm afraid we have form. You know, this is pretty much the history of public health in the UK. It was much more than that. So let's not presume that we can pressurize the government with moral pressure necessarily around those figures. It's you know, we have to do something a little bit more. But it's also going to put about 200,000 to more than 1 million in hospital. That's in addition to everyone else who has to be treated in hospital. That's an extra burden that the NHS was never funded to and still isn't obviously funded to deal with. And it's going to cause at least 1 million each year to suffer from chronic, possibly life-shortening conditions. So that's what we can look forward to. Things are going forward if we allow the government's policies to stand. Well, so where does self-isolation fit into this? And Diane Abbott quite rightly pointed out that, of course, that's not the only problem we have with the current government policies at the moment. They have effectively abandoned public health measures to deal with a pandemic, which is, you know, I can hardly even believe I'm saying it. I mean, it doesn't even compute. I mean, to abandon public health measures in the face of a pandemic and to say to people, you've just got to be sensible and responsible is extraordinary. I know I'm preaching to the converted probably mostly here, but it is really something. Okay, so what role does self-isolation play in all this? Well, the reality, of course, is, as many of you will be very familiar with, is that isolating when infectious is the absolute cornerstone of epidemic control. If we can achieve that, even to not to 100%, but to 70, 80%, we can keep a pandemic under control. In fact, we can get the R sustained below 1 and even in some cases eliminate it. Isolation is absolutely key. The problem is that we haven't been able to achieve this. And the reason why we have lockdowns and other blanket measures is precisely because this hasn't been able to be achieved. Now, why hasn't it been able to be achieved? Well, it's not that it hasn't made a contribution. Self-isolation continues to make an important contribution, which is why it needs to be kept up and in fact strengthened. But the failure to do it properly in the UK and in many other countries is why we've had all these other problems and high death rates and infection rates. And the figures tell us from the work that SPI-B, which is the group that I've been helping out with SAGE, have the figures that they've gathered from surveys. So this is people who they're telling you, they're not hiding it. there's probably other people who are kind of saying that they're self-isolating when they're not, but even self-report are only around 25% with symptoms of self-isolating. I mean, this is quite extraordinary. But then when you look at why that is, it's not because they're bad people. It's not because they couldn't care less. In the vast majority of cases, it's because they haven't got the wherewithal to self-isolate. The government's remuneration scheme has been patchy at the very best, and even where it has been able to be, where people can get it, it covers a tiny, tiny proportion of their living costs. So the vast majority of people, particularly on low incomes, just simply cannot live. They cannot exist and feed their families with the resources that are available. And that's why they haven't been self-isolating. And that has been probably the single biggest failure of the government's control of this pandemic. And that is not because they haven't had advice on exactly what the consequences of their actions have been, because they have, and it's all in these 5B minutes and minutes from other SAGE committees. Okay, so you put that with the low levels of ability to detect and isolate people who are asymptomatic, which is about 40% of cases, and much of the burden of infection, as we know, has been carried by lockdowns and closures, rules and guidance around mixing, social distancing, hand and surface cleaning guidance, and improving ventilation and air purification. Now, I have to say that this last one, improving ventilation and air purification, is an absolute cornerstone as well of how we live with COVID. And that is, again, something I'm afraid that the government has shown no inclination to do anything about in terms of public health measures. Okay, so what will happen if we remove the need to self-isolate? Well, nothing in this pandemic has been for certain. So these are their judgments about what is likely. I think it's almost certain, of course, that far fewer people, even of those who are currently self-isolating, will do it, because it's not a rule. And one of the things that's come out from the data is that even when people have a positive attitude to do something, unless it's a rule, many people won't do it, because it's not normative for them. So making it a rule in and of itself is a really important behavioral device. And the norm gradually dies away. When they stopped requiring people to wear face masks, for example, in shops and so on in the summer, the attitude to wearing face masks was sustained. More than 85% were saying that this is a good idea. But gradually, fewer and fewer people were doing it. And that's how human behavior is. It's also likely to reduce adherence to other protections, because it signals to people it's all over, it's all back to normal. Now, of course, if you then take away the data that people are getting on the number of infections there are and all the other daily data, then it's all then invisible. And the only thing people can see is from their own experience. And we have a situation where we're flying blind in a fog, in a thunderstorm. Can you have a fog in a thunderstorm? Let's assume you can. So it will drive up infections. It will drive up deaths. It will drive up hospital admissions and long COVID, unquestionably. So this policy decision will kill UK citizens. No question about that. Now, when you're going to do a policy change that is going to kill lots of people, unquestionably, even the government would have to accept that. Normally, you do an impact assessment and you publish that. There has been no impact assessment of this. We have not seen the calculations on which the government is making its judgments, which is unusual in public health measures, where this normally has to be done. It will also, of course, raise the risk of a homegrown variant and the rapid spread of an imported variant. So it's a massive risk. So, it's pretty bad. We're going to have to fight it at government level, but also I think we also need to think about how we can act individually and in organisations and with governments like the Welsh government and Scottish government that have been much better to support organisations and regional and local governments to do things which are going to somehow manage to mitigate the damage that's going to be caused by the Westminster government. And this isn't a political thing. This is a public health thing. And it's extraordinary to me that this pandemic has been turned by the government into a political matter rather than a public health matter. Anyway, so in addition to that, apart from the self-isolation issue, we need to think about how we're going to move forward with the other measures, because it will only ever be part of the picture for the reasons I've said. And one of these, and probably the way to think about it, is how we're going to create safe spaces for people. How are we going to protect people in spaces where there will be other people who may be infectious? How are we going to get that? How are we going to stop people coming into those spaces who are infectious? And how are we going to protect people when they're there? We definitely need a huge investment in air filtration and ventilation. And above all, as we have with road safety, as we have particularly with air transport and food hygiene now, very few people get food poisoning in restaurants and so on. And there's a reason for that. It's not left down to individual responsibility of customers to see whether their food is contaminated with bacteria or not. There are rules around it. And that's how we stay safe. And we do it with the consent and, in fact, enthusiastic consent of the population, because people don't want to die in air crashes and they don't want to get food poisoning and they don't want to get COVID. And all our evidence from the surveys is that the public are behind better protections. And so what the government is doing is against what the public wants. So that's a positive. And on that note, I shall stop sharing. And I think that's maybe a positive note on which to end. The public are with us on this. The public are with us. So if we can mobilize the public to do what's needed, then maybe we can change the government. Maybe we can mitigate the effects of government decisions. Thanks.
Thank you so much, Professor West. That was incredibly informative, and I did like that hopeful ending. So our next speaker is Dr. Coral Jones, who, amongst many other things, is a member of the Socialist Health Association, which organizes and campaigns for better outcomes for both patients and health workers. Dr. Coral Jones is also a GP and can provide us with an insight about how GP services are being overloaded by the government's let it rip policy on the virus and what the future might hold. It's great to have you back, Coral. You're muted.
Sophia, thank you
there
very
we
much.
Go.
Now I need to, hang on. Yes. So, yes, thank you very much. I'm also a member of Doctors in Unite, and I'm a member of Hackney South and Shoreditch CLP. So at the height of Storm Eunice on the 18th of February, 4 people were tragically killed. And we know these people's names, we know their ages, where they lived and worked, and how they died. On the same day, 157 people died from COVID. And in the public realm, these people are nameless and unacknowledged. And they join, unfortunately, the 178,000 other people whose deaths have been pushed out of public view by a complicit press, medical and scientific advisors confounding the evidence, and a government which has used COVID to enrich their friends and the Tory party donors instead of saving lives. The government's always taken a half-hearted approach. They delayed lockdown till the 23rd of March 2020, and which my cynical self says that allowed 2 super spreader events to occur, which was benefiting their friends. That was the Cheltenham races and a Liverpool football match. So we had a total of 250,000 people mixing, while people were talking about the need for lockdown. And also at the same time, on the 12th of March, the government abandoned contact tracing. There'd only been at that stage about 20 deaths and about 600 people infected. They said it was too difficult, that the service wasn't up to it. So, but instead of turning to a well-established public health service which existed, which could certainly have coped with those numbers, they said it wasn't good enough. And then lo and behold, 3 months later, we get a private test and trace system starting up, which has been mostly unsatisfactory and an enormous waste of money. So people really suffered during the lockdown, all those weeks of isolation. But during that time, the borders were never closed. 150,000 people were coming in through Heathrow every week in the first lockdown without testing. There wasn't even an information sheet when they arrived. So lockdowns do bring cases down to very low figures, but each time the government has thrown away these hard-won gains by not closing borders and not implementing effective protective measures to keep community transmission low. Lockdown is not needed to achieve low community transmission. And we've seen this in New Zealand, Taiwan, South Korea, and Vietnam, where lockdowns have been very short and focused, deaths are very low, and overall society has kept functioning. So as our last speakers just said, to maintain low community transmission, we need local trusted test and trace, run by councils preferably. Ventilation and HEPA filters are very important, and HEPA filters actually don't cost very much. They're about £200 and they clear well over 95% of the virus from the air. We need routine use of masks. We need to maintain distancing in public buildings, public transport and shops, and of course work from home where possible. And as the last speaker said, financial support to self-isolate for 2 weeks for everybody. So then vaccination becomes a backup to prevent serious illness and deaths if people do get infected. But instead we had lockdown, and then we ate out to spread it about. Pupils went back to schools without adequate ventilation or guidance on masks. People were ordered back to work, protections on public transport lessened, and et cetera, and inevitably rose further deaths and then 2 more lockdowns. But now we're told, don't worry, everything's over, it's back to normal. So despite huge levels of circulating virus and 1,000 people per week dying, all measures are going to be abandoned. So, and how has the government made this acceptable? We need to look at the language used by the government and the press as well. Language designed to deflect attention from the government's dangerous laissez-faire approach with one of the highest death rates in the world. We're told we must be sensible without specifying what that means. So if we get infected, it's our fault. Public health measures such as distancing in shops or masks are called restrictions and not protections. Then there's always a language of freedom versus lockdown. We're presented with a binary choice where freedom means no protective measures at all except vaccines. We're told if we don't have this type of freedom, then we must have lockdown. We're told the vaccines will save us, booster will stop the virus, but unfortunately these vaccines do not stop transmission of the virus, although they certainly do decrease severity of illness and deaths. But indeed, the very definition of death from COVID has changed. Death is now only counted within 28 days of a positive diagnosis. But already 27% of previously hospitalised patients are readmitted, and about 1/3 of these people are likely to die. So this will be more than 28 days after diagnosis, and even if you are in hospital, your death won't be counted as due to COVID. And the current favourite word of the pandemic deniers is endemic. So using the word endemic encourages complacency, as it is portrayed as meaning that COVID-19 will come to a natural end, the wave will recede, or that COVID will become like a cold. This is what the government wants us to believe to excuse their inaction on public health measures. A disease can be endemic and both widespread and deadly. Malaria killed more than 600,000 people in 2020 and is endemic. So endemic does not mean that evolution has somehow tamed a pathogen so that life simply returns to normal. The government must be called out. Abandoning all protective measures is a political choice. It's not based on medical evidence. And once all COVID measures are removed, instead of freedom, 8 million people with chronic medical conditions or disabilities will be locked into their homes to avoid infection. And we'll have more exposed frontline workers in shops, transport, carers, warehouses, factories will face rising death rates despite vaccination. And the poorest will continue to get sick without adequate sick pay and forced to work due to rising taxes, lower pay and higher bills. GPs are very worried about keeping themselves, their staff and patients safe. People need to keep wearing masks and practices to maintain distancing and one-way patient flows in surgeries, and for patients to not come into the surgery if they've got COVID symptoms. The patients will be confused by all this with the messaging that everywhere is safe as long as you are sensible, whatever that is. And people may come without masks and be offended if asked to wear one or to keep a distance. And in fact, there have been attacks in GP surgeries over the last couple of months. And people are very worried about these very patients with underlying illnesses. If they need to come to the surgery, the last thing a GP wants to do is expose a vulnerable patient to risk by coming into the surgery where someone has come to get well. And this won't be the only medical condition this will be the only medical condition that patients are asked to pay for diagnostic tests, unlike all other infectious diseases. Many people won't be able to afford £5 for a lateral flow test, and people will be unwilling to test even if they're unwell, and they will pass on the virus. They may well be unawares because they haven't tested, or they may be unwell, they can't afford to test or to take time off work. Added to that, GPs face more and more people with long COVID without really adequate provision, with an NHS that's being run down and privatised. There'll be more chronic illness from long COVID on top of worsening general health through deprivation and poverty, which has been highlighted throughout the pandemic. And other illnesses have been left untreated throughout COVID because of the unpreparedness of the NHS. And alongside with the introduction of the Health and Care Bill, which will leave many common conditions outside the NHS. So the Tories will always say, oh, all NHS care will be free, but they don't mention what kind of care will be restricted. So GPs are very worried. They're very worried about their immediate surgeries and their patients and their staff, but also they're extremely worried by all the things that are going to cause worsening illness. And I think actually the future is looking very grim. Thank you.
Thank you very much, Dr. Coral-Jones. Our next speaker is Joan Twelves, a long-time activist and former leader of Lambeth Council. Joan is heavily involved in our sister campaign, Zero COVID UK, and writes regularly on the need for much better policy to suppress the virus. Welcome, Joan.
Thank you very much, Nemo. Sorry about my cough, it's not COVID.
Okay.
I don't know about you, but it was really scary waking up this morning to hear that Russia had invaded the Ukraine. I was born just after the war, so I was brought up on my mum's stories of the Blitz. My dad kept very silent about his experiences in the 8th Army. And I've lived through a number of crises. I was old enough to remember the Cuban Missile Crisis, the wars in Bosnia and Serbia, those in the Middle East, and particularly those in Iraq and Afghanistan. And I think you can't put these things into separate boxes because a combination of war, pandemic, and climate crisis all combined is really, really scary. And I think we're all right to be scared. Because a climate crisis means there will be more pandemics, more lethal viruses, as ecosystems are destroyed and more zoonotic diseases jump from one species to another. And of course, war exacerbates the climate crisis. I don't think those Russian weapons are going to be particularly green and eco-friendly, do you? And just last week, it was being said that COVID is rife in the Russian army. So certainly history shows that pandemics usually come after war. So I think in this case, we've got a pandemic before a war and then another pandemic after. And my heart goes out to those civilians who are trying to protect themselves at home as their homes are under attack, and especially those who've been trying to shield to protect themselves from infection. What do you do if you're being told you've got to go and find somewhere safe regardless? And that brings me directly to the subject of this call, because the pandemic is not over, either in the UK nor globally, and I think we all know that. It's sad that the man who parades himself as representing Great Britain at its imperial greatness, who was foreign secretary even, and who supposedly had a good education, doesn't understand what the word global means, and that there is no such thing as British exceptionalism when it comes to a deadly virus. Is he really so arrogant, so egotistical, that he believes he can wish the global pandemic away by snapping his fingers and making an announcement in the House of Commons. Do you remember when we were told the government was following the science? Many of us doubted it from the start, however many times they repeated it. And certainly the objectivity of those scientists in the government's employ was always questioned, particularly from those people who set up Independent Sage under the leadership of David King. But now they're not even pretending to be following the science. It's a word that's disappeared, because this is politics. Politics of a charlatan who's pandering to the right wing of his party to save his job. The fact that leading members of the COVID recovery group cheered his announcement on Monday that restrictions would end showed what side he's on, and it's definitely not the people of this country. The let it rip strategy we have now been forced upon us is a eugenicist policy, purging society of the disabled and infirm, the weak and the poor. The government has washed its hands of delivering the most basic public health protections. By abandoning self-isolation, masks, testing and tracing, and saying it's all a matter of personal responsibility, they are following Thatcher's line of there being no such thing as society and only having regard for individuals who are healthy and rich enough to fend for themselves. I've been shielding for 2 years. I'm at high risk. But it's a common misconception that those who are designated vulnerable are elderly and housebound. It's absolute rubbish. Most of the 3.7 million people who were originally asked to shield will now be in work because they're not allowed to shield anymore. And many of them will be key workers facing the public day after day, or in school. And as will the 500,000 people who've been deemed to be immunocompromised. And these are not static numbers. They're not going to stay at those numbers. They're increasing as long COVID spreads, as more people have chemo for that delayed cancer treatment or get given drugs for other chronic diseases. All those people will now become immunosuppressed. Currently, I'll be in the category of those entitled to a free test after 1st of April. Aren't I lucky? Apart from having to prove I have COVID to get antiviral drugs, I don't actually see the point of this. I don't need to know whether I have COVID. I need to know whether that delivery driver, that electrician, that cleaner, my friends even have COVID and might pass it on to me. Should I pay that £12 for 5 Boots will be charging in April so I can get them to test before I open the door? It seems the only way forward. The whole test and trace system is being dismantled because the Treasury refuses to pay any more. £2 billion a month for the free test is being quoted. But if the test and trace system hadn't been outsourced at the beginning and those billions thrown away to pay for private sector consultants, then there'd be plenty of money to pay for free tests to continue. Similarly, without the 8.7 billion of losses on PPE contracts and the over 20 billion of bounce back loans, which are either fraudulently claimed or not expected to be repaid, again, there'd be plenty of money to keep a public sector test and trace operation going. And don't think it's going to get reset up quickly if and when new variants emerge. I was told today to take down the QR code in our community centre and to delete all contact tracing data. So it's not just free testing, it's also the tracing that is going to disappear. Making us pay for tests, so we all know most people won't, especially without sick pay or support if they are positive, is just part of the Tory ideology coming into play. As Coral said, diagnostic tests are part of what we pay for when we pay our taxes to fund the NHS. Charging for COVID tests is a first and a very nasty precedent. What's next? Paying for HIV tests, for cervical smears, having to go to a private clinic to get one done? Christina Pagel of Intensify says, without data, we are blind. We already know that despite the brilliant vaccines, of which I'm so great a fan, I've already had 4 jabs, COVID breaks through their protection as it mutates. But without testing, we won't know whether it's mutated, certainly not in time to act to do something fast about it. Yes, I know they gave in and said the ONS survey would continue. I'm one of the people who do get tested for the ONS survey, but they're going to cut it back, aren't they? And it will become discredited, even though it will be the only, along with the Zoe app, will be the only sources of information. Omicron is already being replaced by its more contagious BA2 subvariant. But we won't know how many people have COVID, how many have died, who is infectious, what variant, subvariant or mutation is becoming dominant, because we won't have the data and they will stop telling us what the numbers are on the news. And without that data, we will be told the pandemic is. So, welcome to the war. Thank you.
Thank you very much, Joan. Right, so I'm sorry to say our next speaker was due to be Andy Green from Disabled People Against the Cuts. DPAC campaigns against the huge impositions on disabled people by society as a whole, but by the government in particular. There was one estimate early in the pandemic that showed 60% of all people killed were disabled people, but there's been too little focus on this scandal and the related outrage of dismissing deaths as comorbidities, as if all of us who are disabled or will be just don't matter. Unfortunately, Andy cannot be with us tonight because of illness and has had to give his apologies. So I'm sure we all wish Andy well and a speedy recovery. So our next speaker is Joseph Healy from Zero COVID UK, who will speak on how the fight for a better policy, for a suppression policy, must go on, and continuing campaigning activities. Joseph.
Hello, everyone. So I'm following on from my comrade in Zero COVID UK, Joan. Like Joan, I'm also a clinically vulnerable person, but that's not what I'm going to primarily talk about, because I've been a shop steward on the front line in what is usually a public-facing job, but is also an office-based job, and in the voluntary sector with Unite. And when this whole pandemic started, I, like most people, knew nothing whatever about this subject, but being a shop steward, being responsible for the health and safety of my members, I quickly had to learn. So I went and contacted the TUC, and TUC provided a series of excellent webinars around the issues of health and safety, around information about the virus, as did Unite. And I learned, for example, one webinar with a health and safety executive, that there was no legal right for the employer to protect the safety of an employee in their transport to and from work. So the employer could easily say that the person was infected in public transport or whatever, which was a huge loophole in my opinion. We've also since discovered that the health and safety executive, who legally are obliged to inspect workplaces, have inspected very, very few workplaces during the course of this pandemic. And there's a real gap there, which needs to be addressed long term. So for me, it was a steep learning curve, learning a lot about the virus. I recognized early on that ventilation was going to be a major factor. Now, my workplace was closed and everybody was working remotely until the autumn of 2020, when apparently there were some moves to return people to the office. But, you know, I because of the fact that I'd been attending these webinars and information to the union, I pointed out that many of the risk assessments which my employer produced for our workplace were deficient. And we're in a building which contains a lot of other charities. And there was a risk assessment for that building, including proposals to meet vulnerable members of the public in rooms on the ground floor with no ventilation whatsoever. And I just drew a red line through that and said that was totally unacceptable. At the time, I think a lot of people were not as aware of the ventilation issue as they are now. A lot of people seem to think that as long as there was a cleaning fluid and lots of mops around, that was sufficient to address the situation, but it was far from sufficient. To refer to what Joan said a moment ago, I noticed in the debate in the Commons on Monday that Mark Harper, leading member of the COVID recovery group, said to Johnson, "Oh, I'm delighted to see that you finally joined the COVID recovery group. You know, we invite you along, and it's a pity that you didn't join sooner." So, you know, it's clear evidence that Johnson, particularly under the influence of Sunak, who all through this has been a big supporter of the Great Barrington Declaration, has completely signed up now for all of their pseudoscience which will lead, as many people have said, to the deaths, illness of millions of people. So the Unite guidance, the documents which came out from the union, were very, very helpful to us as shop stewards and reps. And we presented those to our employer and went through them in the course of negotiations. And the director of my organization actually said, we find the union information really helpful and informative, and we wouldn't have known a lot of this without you. So we actually prevented the workplace reopening without proper ventilation and so on. That is still the situation. But included in the risk assessments, we looked at the issue of clinically vulnerable workers and the fact that, you know, those workers would need to be protected. And there are several of those workers in my workplace, including people who are living and are the carers of clinically vulnerable workers. And that is a really important aspect the union has been able to fulfill. But I'd like to contrast that with non-union workplaces, as in the building in which I work, many of the other workplaces are not unionized. And those workplaces have had people going back into that unsafe building from about August, September. So, you know, one young trade union has said to me, actually, we have noticed that our organization is one of the few which hasn't been doing that, and that has been due to the work that you've been doing with the union. But ignorance of this condition still continues, and one of my colleagues was recently in the building, and one of the workers from the building said the radiator was on, and said, why have you got the window open? You're just wasting energy. And she had to point out, you know, it's to do with COVID and ventilation. So the levels of awareness of basic issues like ventilation are still fairly basic. And the air filtration system, one of the demands that we have made of our employer is that there are actually HEPA filters placed in our offices. We've had a lot of information from that, from the hazards campaign. We've worked very closely with them. I've been to a number of their webinars, and it's a really excellent resource for any workplaces or for trade union activists. The other good thing that's emerged is due to some of our pressure in Unite, the union has decided that all future meetings and conferences and so on will be hybrid, so that both disabled people who cannot attend physical meetings, but also clinically vulnerable members will be able to play a full role in the union. I think that's been very important. The other thing that happened in our workplace is that prior to the pandemic, there had been no home working policy whatsoever. And we have now produced a home working policy, which will protect some members who will be able to continue to work remotely. And we've made sure that that's also equality proofed, which I think is vital for any policy. I would like just to say to the union movement that it is very important that the conferences and union meetings remain safe, and that masks and other protective measures continue to be used, because even in my own union, there have been instances of conferences being held where that has not been the case. We need to keep that. Whatever the government is doing, we as the union movement need to keep in place protections like masks and testing and so on for our events. I'd like to finish up by a quote from Dr. Mike Ryan from the World Health Organization, who said recently, the problem about common sense is that it's not that common. And this government has depended so much on this mythical notion of common sense and personal responsibility, but that's not enough. And the union movement is playing a role in protecting workers. And there has been statistics produced showing that health and safety among union workers and unionized workplaces is far superior to those in non-union. And this is also a reason why I think so many people joined the union movement during the course of the pandemic, and the numbers have increased significantly. So I'm hoping that myself and my colleagues in the union movement will continue to uphold the rights of workers and their health and safety. Thank you.
Thank you very much, Joseph. Our next speaker now is a great support and key component of our campaign, Belle Ribeiro Addy MP, the Member of Parliament for Streatham. Belle has been a regular speaker at our meetings, and we very much hope that continues. Belle will speak to us tonight about the dangers that lie ahead and how we can continue to resist this government's terrible policies. Welcome, Belle.
Thank you very much, Nemo, and thank you to everybody for coming this evening, and to the Zero Coalition for inviting me back again today. As you can tell, I'm quite committed to opposing this government's terrible policy in response to the pandemic, and I'm equally determined that we still need a suppression policy for the virus, and that has to be a zero COVID strategy. I want to do two main things this evening. I want to talk about government policy and what motivates it. We've already heard from Professor West what the likely consequences will be, and then I want to talk about the people who are in different ways want to fight some of or all aspects of the consequences and the campaigns that you organise. Those will be my main topics. But first, I want to emphasise some of the points made by some of the earlier speakers and to underline them. There's a really clear reason why we've arrived at a situation where the government and its media supporters are effectively declaring victory over the virus. They now say they will never fight it again, and that has nothing to do with science. None of it has anything to do with facts. According to ONS, over 2 million people a week are being infected, and in the last 7 days, over 1,000 people died. There are 11,000 people in hospital with COVID-19, and over 1,000 people died in the last 7 days who had COVID as the cause of death on their death certificate. The reason for the declaration of surrender against the virus is to save Boris Johnson's neck, and that's the real reason. And I'm shocked that more people are not shocked by that, as it's widely understood and widely accepted. The other point I want to emphasize is the issue of who is hit by this. In many cases, there is far too little data, but we know that disabled people have been hardest hit of all. And some of the commentary around that has been absolutely disgusting. We have entered a new realm in this country where saying that the lives of disabled people are expendable has entered the mainstream discourse, as if it's acceptable to say that. It really, really isn't. And we know that low-paid workers are much more likely to get ill and die than the better off, and official policies to deepen that inequality. You'll soon be paying for tests, for example. Statutory sick pay has been pathetic for years, and it's now being cut, and people won't even get it for the first 3 days. The policy is to make sure low-paid workers continue to be hit harder. And of course, because we live in a society in which racism is endemic, these factors and many others meant that Black and people and Asian people have died in hugely disproportionate numbers, up to more than 4 times higher. There is a further issue which hardly gets mentioned. This is how the oppression of women has deepened. This isn't a case of greater deaths, although of course there have been greater death tolls among both health workers and in schools, meaning that women have in some areas been hit the hardest. There are other ways in which women have especially borne the brunt of the pandemic, as the NHS social care have effectively seized up in many areas and for many functions. The increased burden of caring duties in the home always falls on women, and this has happened on a large scale in the pandemic. I think this issue needs highlighting much, much more. The question we must now ask is why the government is doing all of this. As we know, the immediate cause is to save Boris Johnson from his own backbenchers, but why the COVID research group so vocal? This is because it's been true from the outset that senior Tories did not want any restrictions that would interfere with business. The infamous phrase, protect the economy, and so what if a few old people die? This was attributed to Dominic Cummings and strongly denied by him. But if we judge people on their actions, then it seems clear that this has actually been the content of the government's policy throughout the pandemic. All the late lockdowns, early reopenings, banning masks, blocking vaccines to the rest of the world, allocating contracts to Tory donors, privatisation and undermining the NHS are all part and parcel of the same process. This process is putting business first and listening to business lobbyists. This hasn't worked even in its own terms, as we also have one of the worst economic slumps to go with one of the worst death tolls, but it has been and remains the government priority. But the other side of all the attacks that are taking place on ordinary people, the other side of this is that these are both economic and political and social attacks. So we have fire and rehire to lower conditions and pay. We have surging inflation, and a lot of that is direct. Government price rises, like the energy price cap, fares, and as well as rising national insurance contributions and student loan repayments. The tax changes in April will also make middle and low paid workers worse off. Politically, we have a nationality and borders bill going through Parliament, which Enoch Powell would have been so proud of. And you can be deported to a country you may have never seen because your parents were not born here. And it's a send them back policy. This comes on top of legislation which will trample on the rights to vote, the rights of assembly and protest, legislation that has already been passed, which places police officers and members above the law if they commit torture, rape, and murder. We have an increasingly authoritarian state. Finally, there are the social issues, such as the complete crisis of the NHS. There are attacks on women's right to choose. Young people are being forced onto 0 hours contracts, and the government is effectively raising student loan repayments. And we have racism and sexism so out of control in the police that even the commissioner of the Met finally had to go. So if we take these and many other issues together, we can see there is an all-round attack on ordinary people and working people and all those protected categories suffering from oppression. The government is able to get away with all of these attacks because of how it has handled the pandemic and the fear and panic that has inevitably caused about people's lives generally and their livelihoods. And under the fog of COVID, there is a war going on against ordinary people. That's where all of you effectively come in. You are all campaigning on the issues and many more. You've seen the lies of this government and you've called them out. You are agitating and organizing against them and bringing in new campaigners and activists. In these terrible, terrible circumstances, you are all being so brave. And what you do is very important. We should always try to coordinate as much as possible, as all of these issues are linked. And we should be clear about the government's intentions. They are mounting a huge series of coordinated attacks. They also think they're winning and that they are unstoppable. We have a long, long fight ahead of us. And we have to ensure that we do everything we can to stop them. Thank you.
Thank you very much, Belle. It is a pleasure now to welcome our next speaker, who is Louise Irvin, speaking on behalf of SOS NHS, a major new campaign to highlight the crisis in the NHS and how to resist it. Louise will be able to outline the scale of the crisis in the NHS, why the campaign was formed, and how people can get involved. Welcome, Louise.
Oh, thank you very much, Nemo. I'm now just going to go onto my page with my speech. Thank you for inviting me again to talk to you. I think, this Zero COVID campaign is fantastically important, but I'm not going to talk specifically about COVID. Other people have spoken very well about it. I'm going to talk about this SOS NHS campaign. We all know the NHS is in crisis. We've said it, we keep saying it. And I was just talking to a colleague of mine just today, a young doctor, and, she was talking about a case that was really very badly managed in one of our biggest hospitals in London, and not at all typical of that hospital, normally very, very good. And it's just patient not getting followed up, patient not getting seen, patient not getting the tests, and just a horrible experience. And she said, this is happening because the hospitals are on their knees. She said, it's because there's not enough staff and there's not enough equipment, there's not enough beds. There's just a terrible situation. And the problem is it's across the board. I mean, I come from general practice, but whether it's hospitals, whether it's general practice, whether it's mental health care, whether it's a community, which is the district nurses, etc., whether it's public health, which is supposed to be there to help prevent illness, or whether it's even our sister public service, which is social care, which is so intertwined with healthcare. All of them are in terrible crisis. And it's partly, 10 years of underfunding. On top of that, the COVID pandemic for the last 2 years just been very, very hard for everybody. Understaffing of huge proportions, 100,000 staff short, staff leaving early or joining, new nurses joining and then not staying because the conditions are dreadful. Staff pay hasn't kept up with inflation, is now worth 15% less than it was worth 10 years ago. On top of all that, being underpaid and overstressed and overworked, there was just no recognition of this great sacrifice that many NHS staff made over the COVID pandemic. And many are actually suffering from mental health problems, even PTSD, post-traumatic stress disorder, very little support for them. As well as that, the NHS itself, hospitals are crumbling. There's about £6 billion worth of backlog maintenance that's supposed to get done, of which £3 billion is crucial. You're talking about buildings that are in danger of falling down or bits falling, off them, crumbling. You've got equipment, ancient MRI and CT scanners that haven't been updated. It's, so that whole dimension, it doesn't sound very exciting, but this is very, very real. You can't run an NHS if you haven't got the equipment and the buildings to do it. As well as that, we've had a decade of handing more and more services to the private sector, which has accelerated under COVID, where you've seen billions and billions of pounds worth of contracts going to the private sector without proper, even competitive tendering. Now, I'm not really in favour of a market in the NHS, but there's one thing that's worse than a market is no market. It is an unregulated market. You just dish out contracts to your cronies who may or may not have any track record of delivering on those services. And we can see that huge failures of test and trace, but PPE equipment, all kinds of areas where there's been terrible, terrible wastage of massively important resources. If we'd even spent a fraction of that money on actually putting in proper ventilation and HEPA filters in workplaces and schools, etc., we would be a hell of a lot better than we are, in better situation than we are now. So the waste is doubly awful, because you can think about how much differently that money could have been spent. And it could have also been used for a decent pay rise for NHS staff. They were first of all offered 1%, and then with some campaigning and fighting, they were offered a measly 3%, already eaten up by inflation. So the unions are gearing up for joint action to demand a substantial pay rise for NHS staff. At the moment, we've also got this health and care bill going through Parliament, which will enable even more, deregulate even more, so it'll be even easier just to give the government to give contracts to whoever they feel like giving, and actual seats on the boards that are making decisions about where those contracts go, making decisions about how NHS resources are spent. There will be seats for the private sector on those boards. So this health and care bill is absolutely shocking, and we've also been campaigning against that separately and together. But this campaign, SOS NHS, is quite specific. It's to have a kind of urgent gathering together of all the campaigns and unions that want to do something now to rest. The NHS is on its knees. There won't be an NHS to really defend if we don't do something now. So we've brought together amazing. It's the biggest coalition of campaigners and unions I've ever seen for me personally, more than 10 years of NHS campaigning, probably more like 15 years. There's 48 unions and campaigning groups and organizations have come together, which is fantastic. We've got 3 main demands. So they're very much immediate demands. They're not about, there's a hell of a lot more we have to do long-term for the NHS in terms of, we need to bring in legislation to renationalise it and all kinds of other things. But these are very immediate crisis demands. One is an immediate cash injection of £20 billion, which we are going to be pushing for from Sunak at the spring budget. That's not all the money the NHS needs, but it's just like straight away for open up the beds that have been, the 5,000 beds that have been closed. Don't give the money to the private sector. The second demand is the money has to go into the NHS. At the moment, the private sector is getting a big bonanza of about 10 billion being promised to it to help deal with waiting lists. Now, why can't the NHS deal with those waiting lists? If it got the money, could open up the beds, could employ the staff, they could deal with it. It's not as if the private sector's got a different pool of staff. They're taking the staff from the same pool, so they'll be poaching from the NHS. So we're saying no to the money going into the private sector. It must go into the NHS. And the third demand is a substantial pay rise for NHS staff. So the 3 demands: £20 billion immediate cash injection, fund the NHS, not the private sector, and pay our staff properly as a way of beginning to tackle the staffing crisis. So as I said, it's fantastic. We've had, massive support. All 3 main health unions are supporting it, the Unite, Unison and the GMB. And I've got a list, I might just read it because I think it's amazing. Bakers, TSSA, PCS, NEU, NAS, UWT, CWU, NUJ, NUM, Royal College of Midwives, RMT, and also Zero COVID is in there with all the other campaigning organisations, which is fantastic. There's going to be, we've got a petition, we've got day of action on Saturday across the country, and there are over 80 events happening across England. There may be some happening, 1 or 2 in Wales as well. So if you look at the SOS NHS website, you will see where all the events are this Saturday, and hopefully you'll be able to join in one of them near where you're living. And also we're planning to have some events around the spring budget. So it's going to be an ongoing campaign. The spring budget thing is, I think, towards the end of March, so we'll let you know. The 26th of February is quite an important date because not only is it our National Day of Action, it is, I think, one of the important phases of one of the readings of the Health and Care Bill in Parliament. So we are raising the opposition to the Health and Care Bill as well. It goes together. And I just think we're not going to save the NHS unless we have broad, united campaigning and tell the public, inform the public what's happening to their precious NHS, because we know the public value the NHS and they appreciate NHS staff. We need to explain what's happening. We need to put firmly the blame where it belongs at the government. We need to outline the steps that are needed to save up the NHS, and we need to build a movement that can put pressure on the government. Now that sounds difficult. It's a government that doesn't care about the NHS, doesn't care about people, doesn't care about the staff, doesn't care about patients. We know that, but they do care about themselves and their voters. And they have made U-turns before if there's a big enough push. And I think that's what our hope is, that we can build enough of a movement to extract some changes from this government's course of action. That's what we're hoping. Thank you very much.
Thank you very much, Louise. Thank you. Our next speaker is Wayman Bennett from Stand Up to Racism. We have heard tonight and in previous meetings how Black and Asian people have suffered hugely disproportionately in the pandemic, including in terms of the death toll. This is not natural and not the fault of genetics, as is sometimes claimed. Asian and African countries generally have far lower death tolls than this country. The answer lies in the endemic of racism, which affects every area of life and which has deepened through the government response to the pandemic and may well deepen further. Wayman will speak about these issues and the forthcoming demo on March 19th. Welcome, Wayman.
I'm very glad to join such a distinguished group of people who've spoken about the impact of COVID. And I know it from 2 angles. Firstly, I want to completely agree with what Nima said about the impact of racism and its disproportionate impact on people. Today, it seems like the 4 horsemen of the apocalypse are riding. War, destruction, disease. And the difference is that the people that are riding those horses are our government, of different ministers who are directly benefiting from what's happening. And when they said that they described racism almost as an accidental feature of COVID, it was unexplained. But we know from the report that took place a year and a half ago, led by Dr. Emmanuel Agbona, who's the vice chair of the Council of Wales, and he said that there is a feature running all the way through the research. It centers on long-standing racism and disadvantage and the lack of Black representation within decision-making. The coronavirus pandemic is in some respects revealing the consequence of a lack of action on race equality. Many of the issues we've highlighted have been identified and discussed previously, but they haven't been addressed in any systematic or sustained way. You need concerted efforts to make change. He said that racism is like the coronavirus. You can't see it, but it's there. And I think that that's how we explain the disproportionate amounts of deaths. And I think when the government produced its own report on institutional racism, it was like mass gaslighting of the Black communities that exist in Britain, except for it had a devastating impact. You could read it statistically, and you can read it in terms of the impact it's had on people's lives. The second reason why I think I had a reason to be able to do it is I spent last Christmas in intensive care in a COVID ward. And all I had to do was look around me on the beds of people lying there. And sadly, I have to say that I would say the Black communities were overrepresented in the people that were lying around me. There was dedicated care by the NHS work. And then when you looked at the faces, my consultant was Black, my doctor was Black, the nurses around me were Black and Filipino from all over the world. They literally saved my life. And what I would like to say in two ways, you can see it scientifically, but you can also see it personally. And sadly, I watched many, many people die around me, many young people, and it was pointless. And so for me, you have to understand the impact of COVID. The way they describe these deaths, they just describe them as statistics. When they talk about lifting self-isolation now, it was hard enough. The report highlighted that one of the reasons why COVID spread was because it was so hard for Black communities to self-isolate in their houses because they had higher housing conditions. So what does it mean now when they lift all conditions? When it tells us they don't care. That's the message we're being told. We don't care about you. What we care about is ourselves. And actually, who's responsible for this? Do you remember Matt Hancock? Do you remember that he went for a drink and met his pub landlord and decided to give him £40 million? Do you remember that? Yes, I'll have a gin and tonic and you can have £40 million. Well, you can have that drink free on me, sir, if you're going to be so kind to be able to do that. Due diligence was done, followed by gin and tonic and maybe a couple of brandies. And actually, we found out the proper answer for why you should be given this contract for PPE. Have you done anything with the NHS before? No, but I do run a venue that plays music and many different songs and different varieties of music. Therefore, you can have £40 million. You couldn't make it up. You couldn't make it up if you couldn't make it up the impact that it had on people's lives. The £53 billion that disappeared. Could you imagine if any of us went to work and they said, where's the money gone? It's lost. It was here, but I can't quite locate it. But it has suddenly found its way to some of my friends. If you said that with a straight face, there's no way. There's absolutely no way you'd be able to come out without an inquiry. And then they have an inquiry and find out you gave that money to people disproportionately. You have disproportionate deaths and disproportionate rich people giving to their own friends disproportionately while starving the NHS of the kind of money. And remember when Rashford was asking for £27 million for free school meals and they were having a go at him about it. Yet they gave this, and that's just the tip of the iceberg. That's just one contract. So when we listen to the interaction between deaths and who pays, we have to understand that in plain sight, they lie to us in plain sight. And we should never forget, while they were putting all those restrictions on people, while they were tasing people for being out on the street, in Tottenham, in Manchester, they tased 2 people, that people were 9 times more likely to be stopped if you were Black. What was the government doing? There was a party inside number 10. We won't describe it as a party. It was a gathering. Could you imagine having a rave in one of those places in Stratford, right? And the police come along and they say, what, there's music playing. It's not music, it's just a place. There's drinks being taken place. What would you describe it as? It's a soiree. It's not a rave, it's a soiree. That's what's taking place. And as a soiree, individually, and by the way, most of us are working while we're having the soiree, so it's not even a soiree. It's just an accidental happening. It's happening, a kind of flash mob thing that just happened. But the consequences of that is unbelievable. It's a criminal act. You've got a prime minister for the first time who faces the consequences of the police interviewing you. And by the way, when's the last time you got arrested and they gave you a questionnaire? You're under arrest for a criminal act. And I'd like to give you a questionnaire, sir, which you can fill in your own time. Come on, most of us would have been given the jewelry on our hands and cufflinks and taken straight down to the jail until we explained ourselves about what was going on. Don't forget what happened to Sarah Everhart. Look at what happened there. Look what's happened with the police and the various other elements. When we talk about the interaction between COVID and deaths, we're talking about deep institutional failures, endemic racism within inside the structures. And I want to end up with something that we have to be really clear of. When we see these attacks take place with the impact of inflation, the way it's eroding our wages, then what's important is that we have to make sure that the people that saved our lives don't pay the price. And we have to look for ways of using unity to bring to us. And we have to be aware that the government is actually using the idea of divide and rule to blame refugees, to blame Gypsy Roma travelers, anybody but themselves for what took place. That's why on the 19th of March, I'd like people to march. I'd like to celebrate our unity. Multiracial, multicultural workforce like the NHS, we ought to celebrate it. We ought to say that's what's made the difference. People went beyond and above to make sure that people were kept safe. If you look at the death rates of doctors, have a look at the first 10 set of doctors that died due to COVID. That people literally gave their lives to make sure that people were safe. Yet they turn around and raise the question of migration. I honestly tell you, I never heard anybody who was dying in that hospital look up at the face of somebody who was saving them and said, "Where are you from? Are you foreign? I don't want your foreign hands talking to me." That's not what they were asking the doctor. They were saying, "Please help me. Whatever knowledge you've got, please share with me." That's what came through. So we have to understand that there's a double disease to fight. We have to fight COVID now. We have to demand zero COVID, but we also have to fight the disease of racism that seeks to divide us. We have to look for the ways of unity and making sure that we fight back. I always end up with this. The only two weapons we've got is solidarity and unity. These are the only two weapons that we have. For us, we're peaceful. We don't hurt people, we save people, we work collectively. So let's use these weapons of solidarity and unity to demand justice for the people that died disproportionately and demand that this government's held to account for the disaster that they've done over COVID. So please join us on the 19th of March. Let's march for everything to make sure we protect ourselves and work together, that we have something better, and that the real price, we don't forget the people that have died and lost their lives. We remember the people that died, and let's fight for the living as well. Thank you.
Thank you very much, Wayman. Thank you. Our final speaker tonight was due to be Ben Chacko from the Morning Star, which is the other co-convener of the campaign. Unfortunately, he too has had to give late apologies. But I think you will agree we've had some excellent speakers tonight. Our next meeting will be in March. Please don't forget the petition to stop the ending of self-isolation, and look out for our Arguments for Activists newsletter, which will be out early next week. Also, please do visit the SOS NHS website to see how you can get involved in the campaign to save our NHS. Thank you again all for coming this evening, to our wonderful speakers, and to you all for attending. Have a good night.